Have you ever looked closely at your fingernails? I don't mean for aesthetic reasons, but as an indication of your health. Many people overlook them, but they are like little warning signs for your body. What looks like a harmless crack, a strange line, or a color change can actually be a silent cry for help. A cry for help from your organs, your nervous system, maybe even your heart. Imagine if your nails could talk. What would they say? Maybe watch out, your blood isn't carrying enough oxygen, or your liver is overworked, or even something is wrong with your heart, you need help. Sounds dramatic? It is. For many seniors, these nail changes are the first visible sign that something is wrong inside. And often it goes unnoticed, until it's too late. From the age of 60, our bodies begin to change. Blood circulation deteriorates. Nutrient absorption decreases. Organs such as the liver, kidneys, and heart work more slowly. But do you know what doesn't lie? They don't change for no reason. Longitudinal ridges, white spots, discoloration, brittle ends. These aren't just cosmetic flaws. They are signs that you should not ignore. A study by the Mayo Clinic has shown that over 40% of patients with chronic conditions, such as diabetes, heart failure, or thyroid problems, showed visible nail changes at an early stage, often months before the actual symptoms became noticeable. So your fingernails are more than just dead plates of horn. They are an early warning system, one that can save your life. That's why this video is so important. Today we're going to show you 5 nail changes that you should contact your doctor about immediately. This is not scaremongering. These are real, scientifically proven warning signs. And don't worry, we won't leave you feeling anxious. You will not only learn what these changes can mean, but also what you can do about them, which tests you should have done, which nutrients can help, and how you can make your nails a reflection of your health again. But before we dive in deeper, have you noticed any changes in your nails yourself? Ridges, discoloration, or sudden breakage? Feel free to write about it in the comments. And don't forget, subscribe to Claire Vital so you don't miss a single tip that can protect your health. Ready? Then let's start with the first, often overlooked warning sign. It might surprise you. The first warning sign that many seniors overlook is so-called longitudinal ridges on the fingernails. These are fine lines that run from the nail bed to the tip. Sometimes they are only slightly visible, sometimes deep and clearly pronounced. Many consider them a normal sign of aging, but that can be a fatal mistake. These ridges are often not a cosmetic problem, but a silent indication of internal deficiencies. What is really behind them? Longitudinal ridges are often a sign of iron deficiency, and that is something to be taken seriously. Iron is not only responsible for blood formation, it also supplies your cells with oxygen. If it is lacking, your muscles, organs, and especially your brain suffer. You feel tired, drowsy, and easily confused. You may think, that's just age, but often it is simply a deficiency that can be remedied if you recognize it. But iron is not the only cause. A vitamin B12 deficiency also often shows up first on the nails. This vitamin is crucial for nerve function and cell division. A deficiency can lead to tingling in the hands, unsteadiness, or even depression. And even before you notice any of these symptoms, your nails will show signs of it, in the form of fine, inconspicuous ridges. Another problem that can be related to this is slowed blood circulation. If your heart no longer has enough strength to pump blood efficiently into the smallest vessels, your nails will also suffer. They are poorly nourished, grow more slowly, and show structural change. A study by Harvard Medical School found that patients with chronic heart failure very often had longitudinal ridges and brittle nails, long before they complained of shortness of breath or exhaustion. The nails were the first silent witness to the physical change. But there is also good news. If you identify the cause, you can take countermeasures. A blood test at the doctor's, a targeted diet, possibly dietary supplements. All of these can help to stabilize your nails, and thus your health. So if you have noticed such longitudinal ridges on your nails, don't look away. It may be the first sign that your body needs support. And believe me, it's better to ask your doctor once too often than to react too late. Your body is talking to you. You just have to listen. And now we move on to the second warning sign. A nail that changes in a strange way, curving inward. Many people misinterpret this, but what's really behind it can be shocking. The second warning sign is much more noticeable, and yet it is almost always ignored. The so-called spoon nail. The nail curves inward like a small spoon. The surface is no longer curved and round, but flat or even dented. Some describe it as if you could catch a drop of water in it. Sounds harmless? This change is a strong sign of a serious disorder inside your body, especially advanced iron deficiency. And this deficiency is more than just a little tiredness. It affects your entire energy supply. Without enough iron, your blood cannot transport oxygen. Your muscles become weak. Your heart has to work harder, and your organs begin to suffer. This is particularly dangerous for seniors. Why? Because the body absorbs iron less and less effectively as we age. Even if you eat enough, your intestines may no longer be able to process it properly. And so a gradual decline begins, which first shows up, you guessed it, in your nails. But spoon nails can also indicate an underactive thyroid. If the thyroid gland produces too few hormones, your entire metabolism slows down. You gain weight more quickly, feel cold more often, lack energy, and your nails change. They become brittle, thin, and curved, often without you noticing it immediately. A study by the German Society of Endocrinology showed that in over 60% of people with untreated hypothyroidism, changes in the skin and nails are the first symptoms to appear, long before they are diagnosed. Chronic blood loss, for example, due to internal inflammation or stomach problems, can also lead to spoon nails. In older people in particular, such silent blood loss is often detected too late. But your nails could have been sounding the alarm for a long time. What can you do? If you have spoon nails, be sure to have your iron levels checked, especially ferritin, which indicates iron stores. It is also a good idea to have your thyroid checked by your doctor. These tests are simple, but crucial. Don't underestimate this sign. If your nails are curved inward, it's not a cosmetic flaw. It's your body urgently asking for help. Part 1. In the next chapter, we'll talk about a sign that is particularly deceptive: discoloration of the nail. What looks like a harmless yellow tint can actually indicate completely different, profound processes in the body. Stay tuned. The third warning sign is often hidden in the color of your nails. You may have noticed it before. A yellowish, grayish, or even bluish tint that appears suddenly. You may have thought it was due to age, nail polish, or lack of care. But the truth is often more serious, because discolored nails can be a sign of life-threatening conditions. Let's start with yellow nails. These often occur in people whose lymphatic system is weakened. When lymph fluid accumulates, nails can become thicker, grow more slowly, and appear yellowish, a condition doctors call yellow nail syndrome. And this is by no means harmless. It can indicate chronic respiratory diseases, bronchitis, or lymphedema. But it gets even more serious. Yellowish nails can also be an early sign of diabetes. This is because permanently elevated blood sugar levels cause changes in blood circulation, especially in the extremities. The nails become discolored because nutrients and oxygen are no longer reaching them in the right quantities. In addition, susceptibility to fungal infections increases, which further discolor and thicken the nail. A study by the German Diabetes Society showed that over 50% of people with type 2 diabetes had noticeable nail changes, often before the disease was even diagnosed. Your nails could therefore be the first visible warning sign. And then there is the gray or bluish discoloration. If your nails suddenly appear dull or take on a blue tint, this is an alarm signal. It means that your blood is no longer sufficiently enriched with oxygen, a condition known as cyanosis. This can indicate heart failure, chronic lung disease, or circulatory problem. It is particularly dangerous if it occurs on several nails at the same time. What does this mean in concrete terms? If you notice that your nails are permanently discolored, especially yellowish, bluish, or gray, you should take urgent action. It is essential to see a doctor, to have your blood sugar, lung function, and circulation checked. Your body is warning you quietly, but clearly. In the next chapter, we will talk about a particularly insidious sign, fine dark lines under the nail, known as splinter hemorrhages. What many people think is a small bruise can actually indicate silent inflammation in your heart. Stay tuned, it's getting serious. The fourth warning sign looks inconspicuous, and that is exactly what makes it so dangerous. It consists of small, dark, vertical lines under the fingernail that look like fine splinters. Many people overlook them or think they are a small bump or a harmless bruise, but in reality, these splinter hemorrhages can be a silent cry from your heart. Why? Because these fine hemorrhages often indicate so-called microembolisms, tiny blood clots that travel through your bloodstream and deposit in the small capillaries under the nail. And such microembolisms don't just happen. They often occur in bacterial inflammation of the inner wall of the heart, a condition known as endocarditis. Sounds rare? It's not, especially in older people with weakened immune systems, or who have artificial heart valves or other implants. Such inflammation can occur suddenly, often without clear symptoms. The splinter hemorrhage on the nail is sometimes the only external sign. According to a study by the European Society of Cardiology, such bleeding on the nails was found in over 35% of patients with undetected endocarditis, often weeks before the first serious symptom appears. Anyone who overlooks them risks serious damage to the heart, lungs, or even the brain. But there are other causes for these fine lines: rheumatic diseases, vascular inflammation, or severe infections that attack the vascular system. All of these are processes that take place deep within the body, but leave their first traces on the surface. Important: these bleeds do not grow out with the nail like normal discoloration or spots. They remain in place, a clear sign that they come from inside, and that is precisely why you should never ignore them. So if you discover dark splinter-like lines under your nails, especially if several fingers are affected, or if there is no visible injury, consult a doctor immediately. An early blood test, an ECG or a heart ultrasound can save lives. In the next chapter, we'll talk about a sign that is often laughed off: severely curved, rounded, thickened nails, known as clock face nails. But this shape is often a sign of a creeping oxygen deficiency. Stay tuned, it's about your lung. The fifth warning sign is hard to miss, and yet hardly anyone recognizes what it means. We are talking about so-called watch-glass nails. The fingernails curve strongly outward, becoming rounded, almost dome-shaped, as if you were looking at the back of a Some people notice them by chance, others think they are a quirk of nature, or a cosmetic problem, but the truth is alarming. Clubbing is often a silent indicator of chronic oxygen deficiency in the body, and this usually has deeper causes: chronic obstructive pulmonary disease, COPD, pulmonary fibrosis, lung cancer, heart defects, or cirrhosis of the liver. Yes, even intestinal or thyroid problems can cause this symptom. Part 2. Why do nails change? Because permanent oxygen deficiency causes the tissue under the nails to swell, the fine capillaries expand, the connective tissue multiplies, and the nail curves outward. It is the body's way of adapting to an internal emergency. But instead of helping, this change signals that something is wrong. A British study of over 1,000 seniors with lung disease showed that more than 60% developed clock glass nails in the advanced stages, often months before the final diagnosis. Recognizing them early can prevent worse consequences. It is important to note that this curvature usually affects several fingers at the same time, often on both hands. It develops over weeks to months. If your nails suddenly look different, if they shine, become round, or the fingertips appear thickened, do not wait. See a doctor, have your lung function checked, get an echocardiogram, or have your liver values tested. The earlier the cause is identified, the better you can counteract it, especially in older people who complain of shortness of breath, constant fatigue, or cold hands. This warning sign is a crucial piece of the puzzle in the overall picture of your health. In the next chapter, we take a look at seemingly harmless white spots and lines on your nails, and what they can reveal about your nutritional status. They could be the key to a hidden deficiency that is weakening your energy, immune system, and even your muscle. White spots on your nails. Almost everyone has had them at some point. Small dots, sometimes horizontal stripes. Many people dismiss them, saying that's from bumping into things. But if these white discolorations appear regularly or even increase, there may be more to it than meets the eye, and it particularly affects people over the age of 6. These spots are known as leukonuchia in medical terms, and while individual spots may be harmless, multiple, recurring spots often send a clear message: your body has a problem with its nutrient supply. The most common cause is a zinc deficiency. Zinc is a key mineral for wound healing, the immune system, skin, hair, and nail. Without sufficient zinc, the nail cannot form properly. Air pockets develop and become visible as white spots. Zinc deficiency is more common than you might think, especially in older people whose digestion is less efficient, or who take certain medication. However, calcium deficiency, iron deficiency, and even protein deficiency can also manifest themselves in this way. A report published in the Journal of Dermatology for the Elderly in 2019 showed that over 45% of people over the age of 65 with white nail spots also suffered from a subliminal nutrient deficiency, often unnoticed because the symptoms develop gradually. But it's not just spots. Transverse white lines, known as Mies lines, also deserve attention. They can indicate serious metabolic problems, chronic poisoning, or even previous chemotherapy. If several nails are affected at the same time, extreme caution is advised. And then there is the combination: white spots, brittle nails, slow growth, a silent cry for help from the body that something is missing. Often what keeps your muscles strong, your bones stable, and your immune system alert. What can you do? Have your nutrient levels checked by your doctor, especially zinc, iron, calcium, vitamin D, and B12. Sometimes a targeted diet is enough. Sometimes supplements are needed. But don't ignore the signal. It's one of the last visible signs before real exhaustion, susceptibility to infection, or muscle weakness set in. In the next chapter, we'll talk about perhaps the most frightening warning sign: nails that peel or fall off completely. What's behind it? And when is it an emergency? A nail that comes loose, a piece that suddenly breaks off, or worse, the entire fingernail lifts off the bed and falls off. It sounds dramatic, and it is, because when nails peel off it is rarely harmless, especially in old age. This phenomenon can indicate serious internal disorders. Medically, this process is called onycholysis. The nail separates slowly or suddenly from the skin underneath. The area turns whitish, sometimes yellow, and later the nail falls off completely. The cause? There are many, and many of them are warning signs. One of the most common causes is a thyroid disorder, especially hyperthyroidism. This causes the metabolism to speed up so much that nail growth is also accelerated, but in an unhealthy way. The result: the connection between the nail plate and the nail bed becomes brittle. This is often first noticeable on the ring or index finger. However, chronic circulatory disorders, heavy metal poisoning, extreme protein deficiency, or fungal infections can also cause the nail to detach from the body, and this is where it gets tricky. A detached nail is not just a cosmetic problem. It opens the door to infections, inflammation, pain, and can have a massive impact on everyday life. Part 3. A study of over 800 seniors, published in the International Journal of Clinical Dermatology, showed that over 70% of patients with spontaneous onycholysis had previously undiagnosed internal diseases. The detached nail was the first visible sign. It is particularly dangerous if the nail is discolored, painful, oozing pus, or the skin around it becomes hot. In this case, you should see a doctor immediately. This could be a sign of serious inflammation, or even necrosis. What can you do? Check your nails regularly. If a nail comes off without you bumping it, get your thyroid, protein levels, liver function, and blood circulation checked, and watch out for accompanying symptoms, such as weight loss, hot flashes, fatigue, or muscle waste. In the next chapter, we will take a look at color changes, especially nails that suddenly turn yellow, blue, or even black. What is harmless? And when is there something life-threatening behind it? Yellow, blue, or even black nails, they immediately catch the eye, and yet many people do not react because they think it's probably just a bruise. But beware, color changes in the nails can be much more than a cosmetic problem, especially in seniors. They can indicate silent diseases, some of which are life-threatening. Let's start with yellow nails. They appear thick, discolored and sometimes slow to grow. This is often caused by a fungal infection, but not always. If several nails turn yellow at the same time and you also notice swollen legs or shortness of breath, this could indicate a lymphatic drainage disorder or even chronic lung disease. In geriatric medicine, this is known as yellow nail syndrome and should always be checked by a doctor. Bluish nails, especially when they occur in cold weather, almost always indicate a lack of oxygen. This is typical of heart failure, pulmonary fibrosis, or COPD. The nails, often together with the lips, take on a blue-gray color because the blood is no longer sufficiently saturated with oxygen. It's your body's silent cry, "I can't get enough air." The situation becomes even more critical, with black or very dark discoloration, especially if it appears under the nail and does not disappear. Of course, sometimes it is just a bruise from a knot, but if the area gets bigger, remains painless, and does not grow out, it could be a subungual melanoma, a rare but aggressive form of skin cancer under the nail. This change often goes unnoticed for a long time, especially in older people with poor eyesight or limited mobility. Brown or gray streaks, especially if they are irregular or multicolored, should always be examined by a dermatologist. A simple nail change can be the first sign of a systemic disease that you are not yet aware of. The motto is observe the color, take changes seriously. Your nails are like little windows through which you can see deep inside. The next chapter deals with the seemingly most harmless, but most common phenomenon in seniors: brittle, cracked, or splitting nails, and why they often reveal more about your bones, immune system and diet than you think. They tear when you open a bottle. They splinter when you get dressed. They break off, even under gentle pressure. Brittle nails are not a coincidence, and definitely not just a sign of aging. They are a mirror for deficiencies, hormonal changes, and even bone loss. The medical term is onychorexis. The nails are grooved lengthwise, dry, tear easily, or peel off in layers. What's behind it? Often a deficiency, namely a lack of biotin, zinc, iron, or vitamin A. Studies show that over 65% of seniors with brittle nails suffer from one of these deficiencies, without realizing it. A particularly common trigger, iron deficiency. Even without visible anemia, iron is essential for supplying oxygen to the matrix cells in the nail bed. If too little iron reaches this area, nail growth is disrupted. The result: thin, brittle, often pale-colored nails. Women after menopause and men with gastrointestinal problems or chronic inflammation are particularly affected. It goes even deeper. Underactive thyroid, especially in older women, often leads to dry, brittle nails. The thyroid gland regulates our cell metabolism. If it works too slowly, nail growth also suffers. Undiagnosed hypothyroidism can therefore first show up on your hand. Brittle nails are also an early sign of osteoporosis. Why? Because nails, just like bones, contain collagen and minerals. When the body starts to conserve bone, this often shows up first in the nail. A long-term study by the University of Milan showed that over 40% of women with osteoporosis had suffered from brittle nails for years beforehand. And finally, brittle nails are a warning sign of impaired nutrient absorption. This affects many seniors with stomach problems, diabetes, or who take medication. People who take acid blockers, blood pressure medication, or anti-inflammatory drugs have difficulty absorbing vitamins and trace elements, which can affect the skin, hair, and nails. So what can you do? Don't dismiss brittle nails as a minor issue. Have your blood values checked: iron, zinc, biotin, vitamin D, thyroid. Eat a mineral-rich diet. And remember, your nails show what your body urgently needs.